Hello everyone. So we are going to begin with the module on glomerular disorders. So when we begin to discuss this group of glomerular disorders, it is very important to have a solid understanding of the basic structure of the glomerulus. Because see, in medicine, when you have a disease and certain manifestations, there is always a reason why that particular clinical feature occurs. So to understand the glomerular disorders, you have got to get your basics very right. So we will just have a quick revision, I would say, of the basic glomerular structure, okay? And then we will move on to the glomerular disorders. All right, okay. So let's start with the basic structure of a glomerulus. Glomerulus, the basic structure, okay. All right. So in this particular module, I am just going to show you some pictures to begin with, okay, so that we'll make life easier. So because always when you, in nephrology it is like that, you have lots of pictures so that it is easy to visualize, okay, and because you have got to have a good degree of a 3D imagination as well, to understand how the disorders affect the glomerulus and what all changes happen in the glomerulus as a result of that, okay. So first of all, starting with a basic picture which everybody knows, okay. So you can see here, you have the afferent arteriole, yes, the efferent arteriole, and the tuft of capillaries that you see here, that is the glomerulus, okay. And this one that you can see is the Bowman's capsule. Yes, you can see the Bowman's capsule, and the glomerulus and the Bowman's capsule together would make up the renal corpuscle, okay, together would make up the renal corpuscle. So the Bowman's capsule is having, you have a parietal layer, okay, you have a parietal layer here, as well as you have a visceral layer of the Bowman's capsule, okay. So in this module, you know, the visceral layer is very important for us, okay, which why I will come to it later, okay. So I think so far is very clear: efferent arteriole, glomerulus, the Bowman's capsule, the renal corpuscle, the parietal and visceral layers of the Bowman's capsule, and you see here the proximal convoluted tubule, okay, basics, okay. All right, now just let's try to go to the more finer details, okay. Again, this is another picture, just again the same representation with much more details. You can see the efferent arteriole, all right. And you can also see the Bowman's capsule, yes, Bowman's capsule. And you carefully look here, this is the parietal layer which I am currently marking of the Bowman's capsule, okay, the parietal layer of the Bowman's capsule. And then, you know, this layer comes inwards, and subsequently you have what? The visceral layer, okay, that is what I am marking, okay, the visceral layer of the Bowman's capsule. The visceral layer is there, okay, of the Bowman's capsule. Now first point that you have got to know is that the visceral layer of the Bowman's capsule will contain certain highly differentiated cells. And tell me, what is the name for that highly differentiated cells that you have in the visceral layer of the Bowman's capsule? You call it the podocytes. You call it the podocytes, okay. Now, why is podocytes very important in this module? Because the food processes of the podocytes, okay, the food processes of the podocytes are very closely linked to your glomerulus. We will come to the pictures soon. So, which is why in this module always keep in mind what is this podocyte also, okay, very important component of the glomerular filtration membrane, okay. You have a filtration membrane consisting of the glomerulus and the food process of the podocytes. Okay, so this is again very, very important. All right. So you see here, you have already seen the Bowman's capsule, the visceral, the parietal layer. Okay, and subsequently, can you see quite clearly the glomerular capillaries? I'll just highlight for you the rounded structures which I am marking. Okay, these are the glomerular capillaries. Glomerular capillaries. Yes, very clear. And will you also agree with me when I say that these glomerular capillaries are lined by endothelial cells? Yes, you have endothelial cells lining the glomerular capillaries. Okay, very important. And if you can clearly see here, the filtration membrane that is formed, this is actually a cross section, okay, of the filtration membrane, where you can see that you have the layer of endothelial cells, and this is the layer of endothelial cells of the glomerular capillaries. And it is quite obvious from this picture that you have certain gaps here, okay, certain gaps, okay, in between the endothelial cells. And what will you call those gaps in the endothelial cells? Tell me, what will you call those gaps in the endothelial cells? They are called filtration. They are called fenestrations. Okay, they are called the fenestrations. They are called the fenestrations. So in the capillary endothelium, you have lots of gaps which are fenestrations. Okay, very important in the capillary endothelium. Okay, and see, the glomerulus as such will be consisting of 3 layers. Okay, 3 layers are there for the glomerulus, or you can say 3 components for the glomerulus. So what are the components of the glomerulus? What are the components? Number 1, you have the capillary endothelium, which we have already seen. Okay, it is the layer which contains certain fenestrations as well. And second, after the capillary endothelium, you have the glomerular basement membrane. Glomerular basement membrane is there. Okay, so which you can see here, that is highlighted in green. Yes, the GBM or the glomerular basement membrane. Okay, so that also is very clear. Okay, and the third component of the glomerulus, okay, I am talking of the glomerulus, is the mesangium. Okay, mesangium. The food processes of the podocytes, which are actually a component of the filtration barrier, is a component of what? The visceral layer of the Bowman's capsule. Okay, so I am talking of the components of glomerulus. It consists of capillary endothelium, basement membrane, and mesangium. So capillary endothelium, we have already learned, it consists of fenestrations, and then you have basement membrane, and then you have the mesangium. Okay, all right. So we will just see the next structure in the same filtration barrier after the basement membrane. Are you able to see the podocytes? And these structures that you see are the food processes of the podocytes. Okay, they are said to be the food processes of the podocytes. Food processes of the podocytes. Okay, so together they will actually form the filtration membrane, and the transport of the various components of the glomerular filtration happens through these. Okay, it happens through the filtration barrier. Okay, all right. So we will see in detail how it happens. Okay, and so next what I am going to do is I am going to discuss each layer of the glomerulus in short, to understand, okay, what all structures are there and how can it be affected. Okay, we are just building up before we move on to the glomerular disorders. Okay, so first of all, I told you you have a this is the a structure just to show you glomerular capillary and the lining endothelium. Okay, And then are you able to see small pores? Yes, all these small pores which are actually fenestrations. I already told you, you have fenestrations in the capillary endothelium. Okay, these are the fenestrations. Okay, so just to show you the glomerular structure once again, are you with me when I show you the capillary here? So are you able to demonstrate, are you able to see the capillary with the capillary endothelial cells and the foot and the fenestrations in the capillary endothelium? It's clearly shown in red here. Okay, so that you can see. Okay, and these are the endothelial cells. And then what is the next layer? You have the glomerular basement membrane, and in between you have the mesangial cells. Okay, so the mesangium is consisting of two components again, that is your mesangial cells as well as the mesangial matrix. So you can see the mesangial cells here, and also you are able to see the foot processes of the podocytes, okay, of the visceral part of the Bowman's capsule. So it is again a tight component of the filtration barrier. Okay, so you are able to see that. Okay, all right. So let's see the first layer, capillary endothelium. First point that I want to tell you about capillary endothelium is that the capillary endothelium is negatively charged. Okay, so the capillary endothelium, okay, endothelium is having a negative charge. Now, the question you should be asking me is, why is it having a negative charge? Because over the capillary endothelium, if you can notice this picture showing the filtration membrane, the various components of the filtration membrane, are you able to see that there is a endothelial glycocalyx, this particular layer of glycocalyx? Okay, this particular layer of glycocalyx you are able to see, yes or no? Okay, so this particular layer of glycocalyx that you are able to see is actually a covering of the glomerular endothelium, and this glycocalyx consists of certain sialoglycoproteins. Okay, it consists of certain sialoglycoproteins, and because of these sialoglycoproteins in the glycocalyx, where in the glycocalyx your capillary endothelium will be having a negative charge. Okay, your capillary endothelium will be having a negative charge. Okay, that is very, very important because see, in the glomerular filtration is actually highly selective. Okay, it will not allow the passage of certain molecules, but you have got to have the filtration of your plasma and you have got to have a urine formation. So the filtration barrier has to have good selectivity. It should not allow proteins like albumin to go out. Okay, so you should have that special properties for your filtration membrane, and your endothelial glycocalyx is one that will give it a negative charge, and because of that the other negatively charged molecules will not pass freely across the glomerular across the filtration barrier. Okay, so I hope you are very clear with the endothelial glycocalyx. And also, are you able to see in the same picture the glomerular basement membrane? You are able to see the podocyte food processes, and SD in this picture stands for slit diaphragm. We will come to slit diaphragm in a short while. But me showing you this picture, my only aim is to tell you that there is a glycocalyx that is covering your glomerular capillary endothelium. Okay, all right. So you can see all these RBCs, albumin, okay, all going through the capillaries. Okay, all right. So after having understood the capillaries, that is the capillary endothelium and the fenestrations, and the fenestrations, just keep in mind that the fenestrations that you see here, okay, it will have a gap of around 50 to 100 nanometer. That is the gap of the fenestrations in the glomerular capillary endothelium, 50 to 100 nanometer. Now, second component of your filtration barrier and is the glomerular basement membrane, your GBM. So in this picture also you can see the capillary endothelial cells, the glomerular basement membrane, the food processes of the podocytes. See, the glomerular basement membrane is a very, very important structure, and this GBM consists of, again, certain components. This includes the collagen, okay, the collagen, laminin, okay, and you also have heparin sulfate, okay. So there are different components for this glomerular basement membrane, which actually makes it a very tough structure. But in due course, we will learn about more disorders that can affect the glomerular basement membrane per se, like your thin basement membrane disease, maybe your Goodpasture syndrome, Alport syndrome. We'll see that in due course. But just keep in mind that in glomerular basement membrane, the heparin sulfate that you have here is again an important component that would make the glomerular basement membrane also negatively charged. Okay, see, the glomerular basement membrane is also negatively charged. So that is also very clear to you. Okay, so we are clear with glomerular basement membrane. So next, let's try to see the structure of the glomerulus, where we are trying to understand the mesangium. Okay, so now be with me whenever I show a picture. Always concentrate on your screen, the picture, try to get the concepts right. So when you write notes also, make sure that you have a good visualization of images also, because believe me, when it actually comes to the exam day, for many questions it is your visual impact, that is, you have had of certain images, that are going to help you, at least for certain modules. Okay, one is nephrology, other is neurology, where you have got to have a good visualization also. Okay, so that will actually help you, okay, to make things simple. So even if you have forgotten maybe a few facts here and there, probably once you remember these images, I am sure you will be able to answer correctly. Okay, because it is very, very important. So in this picture, you tell me, are you able to appreciate the glomerular capillary endothelium? Yes. Okay. Are you able to appreciate the green structure, that is your glomerular basement membrane? Yes. And you are also able to see the podocytes as well as all these food processes. Okay, all these food processes of the podocytes, which again form an important component of the filtration barrier. And next we are going to see the third component of your glomerulus, which is your mesangium. So the one that is highlighted in blue is your mesangium. So let's focus on the mesangium here. So as I told you earlier, the mesangium will be consisting of mesangial cells, as well as you will have a matrix of your mesangium. Mesangial cells and mesangium is there in your matrix. Now please be attentive when I tell you this, okay, that in your mesangium, are you able to see the certain microfilaments which are marked here? Okay, so what are these microfilaments? Remember, I told you mesangium is a component of your glomerulus, so it has to have some attachment with the glomerulus, right? So how is that attachment made? Now first focus on the glomerular basement membrane. Are you able to see a term written here by name mesangial angle? Okay, mesangial angle. Okay, are you able to see this term? Yes, mesangial angle. So what is this mesangial angle? Nothing. It's just that you see your basement membrane in green. Are you able to see that it is closely adjacent to the glomerular capillary endothelium, and when it reaches here, I am just trying to use probably a different color, maybe a black color here, that it is at this particular juncture, it is deviating away from the endothelium. Okay, can you see it deviating away from the endothelium? So till that much, it was closely abutting the endothelium and then it deviates. Okay, you are seeing that region. Okay, and are you also seeing certain microfilaments? Okay, certain microfilaments. These microfilaments are the ones which bind the mesangium with the glomerular basement membrane. Okay, so what are microfilaments? These microfilaments are structures which bind, okay, which bind microfilaments. What will they do? They will bind your mesangium to the glomerular basement membrane. Okay, very, very important. So this will bind to the glomerular basement membrane so that it is having an attachment with the glomerular basement membrane, which is why the glomerular basement membrane is said to be, when the glomerular basement membrane is actually contracting, it actually can involve the mesangium also, because the mesangium is closely attached to the glomerular basement membrane. Okay, all right. So this glomerular basement membrane is actually said to be a unit of the, it is the unit that actually contributes to the effective contractility involving the mesangium. Okay, so why did I say like that? Because glomerular basement membrane, by virtue of the microfilaments, is attached to the mesangium. So the mesangial contractility is again dependent on your glomerular basement membrane because of these connections. Okay, and what is this term mesangial angle? It is that region where the glomerular basement membrane would deviate away from the capillary endothelium to move and to cover the mesangium. So that region is what you call the mesangial angles. So tell me, have you mastered this picture? I will just once again go through these components. This is very, very important. Okay, I hope you are able to appreciate once again, because this is very, very important. Okay, glomerular basement membrane, the endothelium, the food processes, and you have the capillary, the mesangial angle, the microfilaments which is binding the mesangium with the glomerular basement membrane, and mesangium consisting of mesangial cells and mesangial matrix. Okay, you have mastered this picture, correct? No? Yes. So that is it on the, so you understood the mesangium as well. Okay, now just a couple of words on the food processes. Though it is not a component of glomerulus, it is an important component of the filtration barrier. You see here in this picture, I am showing you the podocyte food processes, the basement membrane, and the fenestrated capillary endothelium. Okay, so just understand that the food processes, I told you, you have gaps between the food processes also, because you have clearly seen in the previous images also, even between the food processes also you are having several gaps, correct? No, let me show you in this particular picture. Okay, are you able to see all these gaps between the food processes? Okay, but remember that, see, though they are actually gaps, you have certain fine structures across these gaps, and that is what you call this particular structure, that is bridging the food processes, and that is what you call, you remember previously I showed you something by an abbreviation SD, that is the slit diaphragm. Okay, the slit diaphragm. Okay, all right. That is the gaps across between the food processes of the podocytes. Okay, so that is also very, very clear. Okay, now just to sum up what we have learned so far, you have a endothelial cell with an endothelial glycocalyx covering, you have the glomerular basement membrane, you have the podocyte food processes, you have the slit diaphragm that is connecting here. Okay, and in between you have the filtration slit. And remember, this arrow that you are showing, that you are seeing on your picture, on the flow of molecules, water, that is actually showing the filtration that occurs. Okay, that is how the glomerular filtration happens. This is the membrane or the barrier, okay, glomerular filtration barrier across which the filtration would happen. So when we learn the various disorders also, we are going to see what all components of the filtration barrier is affected, and many of the features that you see can be explained if you know these basic structure. Okay, all right. So that is also very clear to you how the filtration occurs. Okay, but having made things simple, I just want you to be in touch with reality also. that the structure per se, the filtration barrier per se, is not this very much simplified as you learn. See, you see here, there are lots of proteins which are actually involved in this filtration barrier. So this is a picture of the glomerular filtration barrier, capillary endothelium, and you can see the negative charge. The next layer is that of the glomerular basement membrane. Are you able to see all these collagen 4? Okay, I told you collagen is a component, and especially you have the alpha 3, alpha 4 and alpha 5 domains of your type 4 collagen. Then you will have laminin also, laminin 11. So these are actually important components of your glomerular basement membrane. And what you see here, these are the food processes. And though the food processes belong to the basement membrane, belong to the Bowman's capsule, it is again closely adherent to the glomerular basement membrane, okay, because all is functioning as a single unit, your glomerular filtration barrier is functioning as a single unit. So are you able to see two proteins here by the name dystroglycan and integrin? So these are actually proteins which will help to anchor your glomerular basement membrane and the food processes of astrocytes, food process of the podocytes together, okay. So that is very, very important. And then see all these molecules, okay, that you see here. Can you see lots of proteins here, okay. So all this is actually involved in the maintenance of an intact glomerular filtration barrier, okay. And you also have in the slit diaphragm, even in the slit diaphragm, you have certain molecules like a nephrin, podosin, all of which are important and will make sense once we discuss the individual disorder. I told you we are building up the important components of this the filtration barrier and your glomerulus, so that you understand this conceptually, how when a particular protein is affected, what impact does it have on the filtration barrier. We will see that later. So this is the complex structure of your glomerular filtration barrier, because I just wanted you to keep in touch with reality also, where it is a complex structure with lots of proteins, molecules, okay. Alright, so I hope you are clear with that. Now just to have a electron microscopic view as well, because in various disorders that we are going to learn, I will be showing you the electron microscopic appearance as well. I am sure by now, even without me telling you anything, I am sure you will be able to identify the what is what, okay. You are able to identify the food processes, yes. You are able to identify the food processes of the podocytes. You are able to identify the glomerular basement membrane. You are able to identify the fenestrated capillary endothelium. Okay. So all this is very clear. And yeah. So this is it about the basic structure of the glomerulus, the filtration barrier. So this knowledge is very important, because as we move forward, let's try to conceptually understand the various glomerular disorders, okay.